started the timer and here is your question. Right, so if you have read and understood considering this surgical and optimization, kindly identify these bones. Can you identify A and B bones? What are you looking at?
A and B, they are the bones of the foot.
Okay.
A is the medial aspect and B is the lateral aspect.
All right. Can you identify number 9 here? What is this? In A?
Number 9 is the lateral tubercle of the talus.
Lateral, yes. Okay, can you identify 19 here in B?
It's a tarsal sinus.
Okay. What is 10? Please.
10 is the medial cuneiform.
How many cuneiform bones are there?
Cuneiform.
3. Sorry. Can you tell me about the, okay, got changed. Can you tell me about the arches of the foot? How many there are?
There are mainly divided into longitudinal and transverse. In
Yes.
the longitudinal, we have medial and lateral arches. So 3 arches of foot.
Can you tell me which bones form which arches, please?
The medial longitudinal arches is formed by the talus, calcaneal, navicular, 3 cuneiforms, and the first 3 metatarsal bones. And,
ligaments and muscles?
The ligaments are mainly the spring ligament and the interosseous ligament for medial. And the muscles are tibialis anterior, posterior, flexor hallucis longus, and medial part of the flexor, medial part of flexor digitum longus and brevis. And on the lateral part, bones I already told, the ligaments are short and long plantar ligaments, and the muscle is the peroneus longus muscle.
Okay.
And
can you, yes, please identify number 6 here.
Number 6, the deltoid ligament.
Can you tell me the attachment of the deltoid ligament, please?
Deltoid ligament is attached superiorly to the medial malleolus of the tibia, and inferiorly it has it is attached to the body of talus and the neck of the talus, and then the tuberosity of navicular bone and sustentaculum talia of the calcaneal bone, and also the spring ligament.
Okay, good. Can you, in diagram C, identify number 1, please?
Number 1 is the anterior tibiotalar ligament.
Anterior talofibular ligament. Okay, and 3, please.
Sorry.
3, where is my cursor?
And tibiocalcaneal.
Calcaneofibular ligament. Okay, can you identify number 3 here?
Oh, it's posterior talofibular ligament.
Calcaneofibular ligament. Okay, 19.
Oh, 3 years. 19 is posterior tibiofibular ligament.
No, talofibular ligament. Okay, 26, please.
26 is the tuberosity of navicular bone.
Yes, good. And 18, please.
18 is the spring ligament.
Very good. Okay, good. All right. What are you looking at? Can you please identify?
Looking at the tendons, muscles,
yes,
the arteries of the dorsum of the
dorsum
foot.
of the foot, yes. So if you can please identify number 1 here. Where is number 1?
Number 1, it's dorsal interosseous.
No, it's arcuate artery. Okay, and if you can please identify number 6 here. This is 6.
6 is the flexor hallucis brevis.
Extensor hallucis brevis, good.
Sorry, extensor hallucis brevis.
Yes, and 7?
7 is the extensor hallucis longus.
Good. And then 12 here.
12 is peroneus tertius.
Yes, good. All right. Okay, if you can tell me which muscles makes the Achilles tendon?
The 3 muscles, gastrocnemius, soleus, and the plantaris.
All right. Okay. Can you please tell me about the arteries of the foot? Can you please tell me the origin of dorsalis pedis and the course?
Dorsalis, there are many 2 arteries of the foot. That is the dorsalis pedis artery and the posterior tibial artery.
Yes.
And the dorsalis pedis artery is a continuation of anterotibial artery when it crosses the ankle joint, and it lies anterior to navicular bone. Talar bone, then navicular bone, and intermediate cuneiform bone, and then it pierces the first and second dorsal interosseous muscle to travel deep to the foot, to go to the plantar surface of the foot and form the deep plantar arches.
Okay.
By joining the.
Please tell me, on the foot, where would you feel the pulses? Can you tell me the surface marking of all the pulses that you can feel on the foot?
We mainly feel for the dorsalis pedis and posterior tibial. For dorsalis pedis artery, we feel lateral to the extensor hallucis longus tendon, in between the first and second metatarsal bone.
Okay,
and in case of posterior tibial, we feel behind the medial malleolus, midway between the medial malleolus and the Achilles tendon.
2 to 3 centimeters below. Okay.
2 to 3 centimeters behind.
Please tell me the structures which pass behind the medial malleolus.
From anterior to posterior, we have a posterior tibial tendon and flexor digitum longus tendon, posterior tibial artery, tibial nerve, and flexor hallucis longus.
Okay, can you please tell me what do you understand by the term, the last one, because we were asking very slowly, mid-tarsal joint of Chopard?
Mid-tarsal joint of Chopard has 2 components. One is the talonavicular part of the talocalcaneonavicular joint, and another one is the calcaneocuboid joint.
Yes. All right. What type of joint is subtalar joint?
Subtalar joint is a plain type synovial joint.
Yes. What type of movements are present at this
subtalar joint, it has mainly 2 movements, inversion and eversion.
Yes, good. Right. And which muscles form the perform these actions?
Inversion is mainly performed by the tibialis anterior and posterior.
Yes.
And the eversion by the peroneus longus and brevis.
Good. All right. What structure stabilizes the ankle joint?
Mainly the ligaments around the ankle joint.
Yes.
That is the medial collateral and lateral collateral. The medial collateral is formed by the deltoid ligament, which has 4 components, and the lateral collateral, which has 3 components, and also the deltoid ligament has 4 components. That is anterior tibiotalar and tibionavicular, tibiocalcaneal, and posterior tibiotalar. Then lateral is anterior talofibular, posterior talofibular, and talocalcaneal. Sorry, calcaneofibular.
This will revise again. All right, good. Thank you. Bell has already gone, so yes, thank you.